My name's Kristen Barber, and I am from the US. I work with small children. On Saturday, I was getting ready to go to a movie with a friend, and I was in the shower. Getting into the shower, I realized it was not a good choice and that I was not okay. So I got out of the shower and held on to the furniture to get to the bed and called my friend. It scared me a lot. My leg was numb from the hip to the toe, and it was tingly, and it just didn't feel right. It wasn't working properly. So I was able to put my clothes on and have my friend come and take me to Ahli emergency.
Since we live so far away, we Skype with her I Skype with her almost every day. And on Saturday, we were getting ready to Skype with her, and we got a message from her saying she was in the emergency room. We knew that her back had been hurting.
She was not able to move her leg. This is a serious condition. This suggested that the nerve is trapped, particularly the right L5 nerve root was trapped and was causing significant pain.
They brought me into emergency and put me in a wheelchair, moved the wheelchair a little bit, and then I had a big sharp pain in my right leg with the numbness, and I started screaming.
Christine was admitted with a sudden onset of radicular pain to the right extremity, which normal people talk about sciatica. It is a radiating pain down the leg, and her pain progressed within 3 to 4 days quite considerably, causing a radiating pain down the leg, affecting her quality of life, affecting her mobility, to extent where she developed a sudden foot drop.
They took care of things very quickly and had a doctor come and look at the MRIs that I brought with me.
An MRI scan is a golden standard in these kind of situations because it will tell us the level of the disc, the size of the disc, and which position it is. And so the MRI scan of the lumbar spine confirmed a fairly sizable disc at the L4, L5 segment pressing on the nerve root.
On the same day, I saw the doctor in the specialist, and when he saw me try to walk, he noticed that my right foot had dropped.
And then she was in the emergency room and she was going to have surgery, and my heart just dropped. I knew I had to come to help and to be with her.
The surgery would remove the pain. Over 90% of patients with sciatica would improve immediately post-operatively. And the second case is that the pressure on the nerve had been relieved by removing the disc which was pressing on the nerve root. And this is a very essential thing.
We talked to her. We were able to talk to her, and she was able to smile a little bit and say that she was in the hospital and they were taking good care of her. And her friends were very good about bringing her here and staying with her and telling us what a good job that the hospital was doing and the doctor. We were very happy about the doctor that she had and that she had such good care here.
After the surgery, I feel much better. There's still some numbness in my foot, but it is moving more quickly than the doctors thought it would.
We went ahead and did the operation for her yesterday, and we found huge sequestrated disc pressing of the L5 root. The disc was removed, the disc was excised. Post-operatively, she recovered well, the pain has completely gone, and the foot drop started to recover. And that's a very, very good sign. And timing is a very important and essential in this matter.
But because I came right away, it will probably recover in 6 months to a year. If I hadn't, it may have never been okay.
When I got here, the security guard outside brought me in, and he brought me all the way up to the room. And she had been sleeping, but it was 3:30 in the morning. But she knew I was here, and I was so glad to see her. She was glad to see me, and she's doing great. She's doing better than I expected, able to get up and walk with a walker, with crutches, but doing very well.
I like to travel a lot, and I often have heavy suitcases because I like to take lots of things with me, so 50 to 70 pounds.
She's always liked to travel and has heavy suitcases, and she lifts those suitcases herself into the car and onto the scale at the airport, and probably doesn't bend at the knees and lift with her legs like she should.
I usually lift them by myself, and I've learned that's not a good idea. So if you're going to carry heavy suitcases, you need to learn how to bend down properly and pick it up properly, or have someone else do it for you. Don't do that to yourself. My entire experience at Ahli has been very nice. Everyone from the cleaners to the people bringing the food, the nurses, the doctors have all been kind and friendly. They've been willing to do anything that I need them to do. They've been helpful to make sure that my friends and my mom have made it to the room and have anything that they need. It smells very clean. The room is spacious. It's very pretty looking. It's very calm.
I'm just so glad she's okay. I'm glad I was able to come. And I'm glad that she had the doctor and the hospital that she did that took such good care of her.
Coming to Ahli Hospital, we have been providing back pain management over the last 8 years. These are informations given to the patients when they come, and also we have used different methods that would help the general public by producing leaflets, producing DVDs that will be useful for people with neck pain, low back pain, mid back pain, so that they can look after their back.